All right, we'll go ahead and get started. Good afternoon. I'm Kyle Spurgeon with the Jackson Chamber, and appreciate all of you joining us this afternoon. And I think one of the things we've talked about throughout this crisis is how well this community is communicating with businesses, government. I'll compliment, I continue to both of our mayors, the health department, West Tennessee Healthcare, for making sure that all of our businesses in the community have the most up-to-date information regarding executive orders and what those orders mean. Today's call is going to be about 45 minutes. Appreciate all of you being on here. And we're going to concentrate, it's for small businesses, really, but we really want to concentrate a lot of our questions for those folks at the salons, tattoo shops, massage parlors, personal touch places, because I think with your group, it seems to me that has been one of the things that's been the hardest to understand, because you've had orders from the governor's level that have changed it several times. And here we just want to make sure that you've got the most up-to-date information about how that works. And because we look forward to you guys opening next week. And I know a lot of you on here do not fall into that category, so feel free to ask questions. All the questions will be done through a chat room. Mandy White, our Senior VP of Economic Development, will manage that, and she is managing this call. We've got both mayors, Mayor Conger, Mayor Harris, are on here, along with Tina Prescott, West Tennessee Healthcare, and Kim Tedford from the Madison County Health Department. We're going to start real quick. Mandy's got a poll that she's going to throw up here, and just ask you to respond to that. And then from there, we'll ask Mayor Conger. He gets to go first. Seniority worked last week with Mayor Harris. We're going to let Mayor Conger start off this week. But Mandy, if you'll throw that quick poll up here.
Kyle, I think because we're both signed in under the same, I just saw the poll won't let me launch. So
all right, we're going to regroup. We're not going to do a poll today. So with Mayor Conger, what I'd like to do with our 4 guests today is just 3 or 4 minutes. And Mayor Conger, just update on the executive orders that will start next week, and then anything else from the city perspective that you want to make sure that folks know.
I mean, good afternoon, everyone. How anticlimactic without a poll to start off. I mean, I don't even know.
I'm sorry.
You can do your own.
Had enough of those. Thank y'all for tuning in this afternoon, and thank you all for being diligent and resilient through this time that none of us planned for, that none of us wanted to be a part of. I know it's been tough for a lot of you. This has not been how I envisioned my first year in office. And so I think that as I can say this, I want to brag on the folks in Madison County, not only the group that works every morning about making decisions on what we can do to maintain safety in Madison County, but all of you all to make sure that we flatten the curve, and we're continuing to flatten the curve so we can start reopening our economy back up. We've gone through this. We've done executive orders on how we want to keep people safe, and now we're going through the process of opening back up. Several weeks ago, we developed a plan with our morning group, which consists of city, county, chamber, JEA, school system, United Way, health department, and West Tennessee Healthcare. And we talk about what's going on in our community. And so through that group, we've developed a plan for reopening, and I'm happy to say that we're planning on entering into phase 2 of the reopen Monday. And that's why a lot of you are here today. And so that is, opening up those, what was deemed non-essential, not by me, but by Department of Homeland Security. I think all of you are essential, but what was deemed non-essential by Department of Homeland Security, those close touch points, nail salons, hair salons, tattoo parlors, massage establishments, gyms, health clubs, pet grooming, things like that. And we're also reopening our city parks on Monday as well. And so I know that we have been working closely. So I'll shut up after this, with the governor's executive order, Madison County was one of the 6 counties excluded from his executive order, so we get to do our own thing. And so we've been working closely with the state on getting those guidelines down to get to you all on how to safely operate. So I'm excited that we can get to this point and start moving forward. And appreciate y'all being here.
Well, good afternoon, everybody. Thank you for joining us. you know, we're all exploring new territory and new things that none of us ever thought we'd be dealing with. But the main thing I want you to know is that I've been in small business, give or take, almost 50 years of my life, and still in small business. And I understand the issues you're going through. And it's not, these have been some really difficult decisions that Mayor Conger and I and Kim Tedford with the health department had to make as far as businesses and individual rights and things like that. It's not been a really joyous thing because, you know, I've always had the attitude about government that government provides the infrastructure and the ways for you business to thrive, but we get out of their way and let them do it. And I understand that we have moved in a different realm here, but maybe we're climbing out of this thing. And the success of our continued ability to reopen businesses lies with all of us, and especially you business owners, in the sense that if we can keep our curve going in a reasonable direction, we can keep on opening businesses. But if we, for some reason, have a big spike, healthcare system gets overrun, there will be some tough decisions to make then. But I feel very confident on what we've seen so far with the retail that has been open, as well as the restaurants, that business owners are absolutely taking it serious, trying to protect not only their employees, but their customers as well. And I know you'll do the same in these, as they call it, close contact businesses. Y'all have a little different responsibility to a retailer because you are in such close proximity with folks, and the ability to them give you something or you get something from them. So it's going to be a challenge for you, but I think you can do it. And just please look and understand the guidance. It's been, believe me, your organizations, state organizations, have been heavily involved in drawing up these guidelines, whether that's business or hotels or beauty shops or whatever. So we feel like we've got a reasonable approach here. This is the state guidance. And other than just, you know, we're opening salons, I think we're opening salons a day, 2 days before the governor is, and we're delaying the opening of gyms 2 days. So we're basically along the same timeline as the state government is. But we can do this, and I know you can do it. And believe me, even though we've made some really tough decisions, we are really here to help all we can.
Mayor Harris, I'll add, we're looking forward to getting the saloons open too. I think that'll make us all very happy. Tina, if you could, go ahead. Tina, if we could jump to you, and from a West Tennessee healthcare perspective, I know in our calls each morning, we go through the census numbers there, how many folks are on vents currently. And all through this, the idea has been to flatten the curve. And I think as a community, we've done an exceptional job of doing that. And that bears out through the numbers that West Tennessee Healthcare shares every morning.
Right. That will be something we will continue to monitor. We are also in a phase of reopening as well, as we reopen on Monday to some of our elective procedures across the healthcare system. And so we are monitoring things across all of West Tennessee each day. Here in Jackson, of course, has been the bigger volumes that we see. But as you know, people across West Tennessee travel to Jackson for their health care. They travel here to eat out. They travel to shop, etc. So that hub of Jackson is very important. So we do keep an eye on the activity outside of Jackson. And we do have a little bit of activity there, but like Kyle said, we report that every morning. So our numbers are ranging around 10 to 15 patients that are positive inside our facilities. Another maybe 5 to 10 that are under investigation that we're doing that testing on, and able to get those results really quickly and understand, kind of keep an eye on how many of those are in the ICU, like you said, and how many ventilators we're using. Those numbers are very manageable, well below the state. If you look across the state, of course, Memphis and Nashville with the higher populations have more of those patients, and we look really good across this whole West District. So we're excited about that. We're so proud of the coordination that's gone on across the healthcare, across West Tennessee for the healthcare system. So thank you to everyone for flattening the curve and keeping it manageable. We'll continue to work together, monitor these numbers with our health department partners and our mayors.
Before we move to Kim, if you remember, so we've set this up, there's a chat room available. If you can, if you've got some questions, go ahead and start loading those up, and Mandy will read those in just a few minutes. And today is designed to talk about how we're moving into phase 2 and how it affects those businesses. But we also want to hear some feedback from those of you who are on the call that opened up last week. What's worked for you, what suggestions you've got, or what questions that you've got. And Kim, if you would, with your comments on the back end, start talking about some of the guidance that we have for the salons and tattoo places.
Okay, be glad to. Hello, everybody. I just want to reiterate what both mayors have said and what, from a public health standpoint, you know, our goal is, our patient is the community. So our goal is to help you keep your employees safe, to keep your customers safe, and to keep the community safe. And just kudos to y'all, because I feel like that we're doing a great job as reflected in the data that we look at every day. As I reported this morning, we've got 108 out of our 145 cases that have fully recovered or are getting better. So that's great. We have a couple of patients that are on the ventilator in the hospital. You know, our thoughts and prayers go out to them, and we still have some people that are hospitalized. But overall, our data couldn't look any better. I couldn't feel any better about it as we move into opening up phase 2. The guidance has been very specific coming down from the state that we've shared and sent out. It's very specific. There was no reason for us as a local group to reinvent the wheel when they had done the hard work and put it out there, and we felt comfortable sharing this guidance. I've got copies of all the guidance around me. There's specific guidance for close contact, service businesses, for exercise facilities, for retail, for restaurant, some universal guidelines. That's all been made available to you. And if we need to share where you can go and find that at the end of this, we will. But I've got copies of all that all around me in case anybody has some specific questions. A lot of the basic guidelines start out with how to protect your employees coming to work, what kind of screenings to do for them, to make sure that you're not bringing sick employees into your facility to expose yourself or to expose your customers. And then the guidelines kind of break down to how to protect the customers coming into your business and specific guidelines for each different business to do that. So we're ready for questions. As far as, I've got all this out right here, so if we need to get into anything specific, I can look at it.
Mandy, if you'll roll with the questions.
Sure, we have a couple so far. In a salon, if a client has tested positive for COVID-19 and let me read this again. Does everyone in salon, including the stylist, have to quarantine for 14 days if someone in the salon tests positive?
An employee or a customer?
A client.
A client. If a client ends up testing positive and we trace them back to that facility, anybody that's been within close contact, and when we say close contact, that's less than 6 feet for a minimum of 10 minutes or more, yes, they will be asked to quarantine at home for 14 days.
Okay. And then one more that came in so far. There is a lot of confusing messaging coming from the Massage Licensure Board saying that the governor's executive order with May 29th date is still in effect for the entire state. People are afraid to do anything that will affect their license and insurance.
I don't know if either mayor wants to speak to this, but as far as the orders coming out from the governor, from what I understood, those orders were lifted when he changed his order to allow salons and all those other businesses to open on May the 6th. Now, like Mayor Conger said, we are different because we're a metropolitan county, so we are allowed to go with what the governor says. We can be stricter, we can be leaner with what he goes with, so we can do our own thing. And so our order that we sent out that's effective on Monday at 12:01 a.m. allows the opening of all those facilities.
And there's no problem in the sense of licensures or anything like that, because while we are following very closely the state guidelines, it is the directives that come out of Jackson and Madison County along with Kim Tedford that's effective for our county, and that's what Kim just referenced.
And I think a little further, Mayor Harris and I have gotten direct clarification from the governor himself on that we are in charge of our own destiny here in Madison County. Mayor Harris and I are also on a statewide economic recovery group committee that meets every day at 11 o'clock and talks about openings, not now list, what the state's doing, and how we can cooperate and collaborate best. And Commissioner Ezell leads that committee, and he makes it very clear every day that it is up to us to make that determination. So those licensures are safe as long as you're practicing in Madison County. Now, if you go to, I'd say Gibson County before Wednesday and try to practice, and that's a different story. But as long as it's in Madison County, then you're okay to open on Monday.
When you go back and look at the governor's original executive order, he was very plain in what he said. His orders pertain to the 89 counties outside of the 6 metropolitan counties, which Madison County is one of the 6 metropolitan counties.
I've actually had a friend who is a massage therapist ask me the same question, because I think the board is telling them that is state law, so they have to follow state law. And of course, they want to be sensitive and not do anything to.
And these are new teams for everyone, and so we're all learning as we're going. And what traditionally is state law that applies to all 95 counties is different right now.
That's right. That's right. I have one more question, and I'll remind you before I ask it that if you're watching on Facebook, you're welcome to put questions there too. I'll try to pull as many of those as I can, and also just comments from last week about what worked, what were challenges, so that we can learn from each other. The other question right now is, are customers required to wear a face covering, and do we have to refuse service if they do not?
Yeah, as far as the guidance, absolutely. Customer wears a face mask, and employees wear a face mask, and you have the right to refuse to serve anyone. However, I mean, this is strictly strong recommended guidance. It's not an order, but I believe that our future success in continuing to open businesses, a lot of it hinges on everybody wearing a face covering or a mask whenever they're out among other people. I believe the face coverings are an integral key to our continued success.
Okay. Those are all the questions that have been submitted at this point.
I will, and I know there's some folks on this call whose businesses opened this week. And Mandy, I think that was the same question. You did have another one pop up about childcare.
Okay.
Go ahead.
Are there any efforts in progress to assist with childcare for non-essential employees coming back to work since schools are closed, are still closed?
I would say yes. We've, as I can just speak for the city standpoint, we're not doing our summer camps this summer because 95% of our supervisors for summer camps fall in a high-risk category. But what we are doing is we've gotten the pool of our counselors that have for the summer camps, and so we're going to provide support services. We're working with nonprofits and churches to provide those support services for any churches, any other nonprofit that wants to do a summer camp or a daycare to help them out that way. So there is a child care option.
I will say from the county standpoint, through Parks and Rec, Ed Smith, they are planning on doing their summer camps. and actually opening a third location just to help keep that number of children down at the 2 sites that they normally use. So that is an opportunity to do that. And I don't know, I haven't heard, but there may be some daycares in the facility that are ramping up to take older children. You could check with your local daycares too, to see if they are doing that through the summertime, since childcare is essential. You know, it's an essential program. It's an essential business. It's an essential need during this time for people that are going back to work and schools are closed.
Okay. A couple of more questions. One on Facebook says, is there any information on when youth sports may start back? And I know y'all have answered those in some other forums, but we may have new people watching today.
According, to our call with Commissioner Ezell and our ERG group, those are a not now area. So, I wish that I could give a date on when and if they're going to start up, but I would say at least through the end of June that youth sports won't be going on. I'm hopeful that we get to do some this summer, but as of right now, not in the immediate future. Again, with everything that we're doing here, it's new, it's fluid. As we get information, as we collect data, everything's subject to change. But I feel comfortable saying probably not at least till the end of June for youth sports.
Okay. And what about?
Let me follow up on that.
Sure.
Man, this group that Scott and I meet with or have a call with every day. I mean, that certainly is on their radar. They are certainly looking at that as to if and when it does occur, what kind of guidance is for that. So that even before we get to the point that the state is comfortable or the health department is comfortable doing this, we hope they, along with us, will have been able to create some guidance for just how that would be structured once it does occur.
What about, so when the parks are opening on Monday, team sports or, basketball, are we required to practice social distancing still? Highly recommended? Where do we stand there?
Yeah, so it's yes and yes and yes.
Okay.
We're opening our parks up on Monday. We will have our folks from our parks department that will be, routinely kind of checking to see things and just reminding everyone that we have to practice social distancing and maintain safe distances and just practice good hygiene and common sense.
Right.
Well, and the county parks, we did not close those. We did close the playgrounds within the parks. We did close the restrooms. They will remain that way. And as Mayor Conger said, I mean, we continually monitor it because the real issue or the real concern we have is that when groups start gathering and they get in the same proximity with each other, we don't know what's there. And if it is there and there's a group that gets it and then they go back out into all aspects of the community, we could be in for some real trouble there.
Sure. Back to a few of the business questions that have come in. Can you please share the guidelines for med spas or where I can find a written guide?
The med spas fall under the close contact business guidelines.
And where can those be found, Kim?
I think Scott's already shared it. It's on y'all's Jackson-Madison-COVID.com.
Mm-hmm.
Yeah, jackson-covid.com.
Great.
And it can be found. It can be found on the state page too.
Yes.
The guidance.
And I think also on our JacksonForwardTogether.com page.
It's TN Promise or
it's Tennessee Pledge.
Yeah.
If you just search Tennessee Pledge, it will take you to there, and the state does put a printable copy where you can print off the guidelines of all the businesses on there. You go to tn.gov and that's the state website. You could just search Tennessee Pledge and it would take you there. And it's got all the recovery plan and all the guidelines on there.
Okay, thank you. A couple of questions from Facebook. I only do walk-ins. Is it okay to have a desk set up with hand sanitizer with a notebook for them to come in and sign in, then go back to their vehicle until their time?
That's not following the guidelines to have walk-ins. Everything needs to be done by appointment.
Okay.
And in fact, it goes as far to say that the customers with the appointments will remain in their car. So there's not going to be any kind of people in the waiting area. They will have to be either come and gotten by the stylist, or they can text each other when it's time for them to come in after the other patron leaves.
Okay. Do you feel that enough time has been given between phase 1 and phase 2 to determine if it is safe to continue to phase 2, since it takes 2 to 14 days before symptoms may show?
We are strictly going by the plan that we developed, and we put those metrics in place. And if we didn't feel safe about it, we would not be. And this is not about feelings, it's about data that we look at. And we've, let me say that, up until today, up to this point, we have met that. Now, I'm not going to go out and say that we are definitely going to have met all these metrics by Monday, because we still have Saturday and Sunday to go. And as sure as I say that, I'll jinx us. So I'm not going to say that. But
I think the important metrics that we have are that our hospital capacity can more than maintain a surge at this point. And out of 145 positive cases, 108 of them have fully recovered. So that's a great metric to look at.
Questions inside is only 5 days, so that's allowed. This stuff.
No.
Without the people that give a ruling, would essentially erase the other goes allowed.
Okay, if you can maintain the social distancing, I mean, if you're talking about competitive race, I don't think there'll be much thought into social distancing.
Right. Makes perfect sense. Hey, more. Services that require removing facial coverings, example, beard, trimming, facials, etc., are not permitted in phase 1. I just read this on the website. Are we now to where facials are allowed?
No, this is our phase 2. That's and I don't know what phase calls it, but these guidances on close contact businesses specifically prohibits shaving, trimming of beards, and things like that, because you can't do that without people removing their mask. And remember, when that customer has a mask on, you or your employee is in close proximity to those people. So that is the reason for that guidance, I believe, and Kim may speak on that more.
yes, that mask on the customer is protecting you as the employer. They're wearing that mask to protect you from their germs. So that's very very specific in the guidelines. And I'm like Mayor Harris, I don't know what phase the governor's calling that, but it's very specific, and it's can't be done.
Okay. What are the guidelines for indoor pools? A local swim club leases the indoor pool at the University of Memphis Lambeth, and Madison County Parks and Recreation Department uses the indoor pool as part of their summer program. At one point, I read pools remain closed.
Pools do remain closed.
Okay. If someone does not feel safe going back to work, do they jeopardize their unemployment PUA payments?
It's
That's kind of over my head, but I think that once you're offered a job, offered your position back, then per state law and per the guidelines of unemployment, you have to take it or you lose your unemployment. Now, if you make it go back, take the job and use your vacation or your sick leave if you don't feel comfortable going. But now that would be something you would need to talk with an HR person about.
Yeah, I think there are some additional parameters in the CARES Act, but yeah, an HR professional would be able to answer those questions, or an employment attorney.
Okay. My apologies if this question is redundant, but are you anticipating that large gatherings will be allowed in Jackson-Madison County by early September?
The way time's
I'm just the
going,
messenger.
September is 2 years away. I mean,
April was the longest year of my life.
Thought it was May, Scott.
It all depends. It all depends on how successful we are in these phases as we're going through them. And if we continue to be successful, there will continue to be an expanding of activities and businesses that can operate. But that's about I know that's vague, but that's about as specific as we can get to it.
Okay. Are daycares to follow the social distancing with their students? And if they aren't, how is that different from other businesses and their guidelines?
I think from the beginning, daycare has been deemed an essential business. And so this is just my very non-healthcare layman thought of it is you have a 5-year-old, it's more dangerous leaving them at home by themselves or dropping them off at a daycare.
And I think the daycares too, while they were deemed essential, and they were, they even employed or they were given some guidance in how to not let parents enter the daycare. They were dropping their children off at the door. They were practicing hygiene, using hand sanitizers, screening their employees before they came to work. They were doing steps that we were encouraging, and they implemented those steps. While it's not the perfect social distancing piece that we would like to see, there were other measures taken and continue to be taken by child care businesses.
I've been asked to ask you about wedding venues. Any clarification on when those may be?
They're still they're categorized under mass social gatherings. And so it's still according to the governor's office in the not now list, and continuing to monitor that as well.
Okay. Let's see. I think those are all the questions that have been submitted at this time.
All right. And Mandy, I think we can do this. And I want to ask the question. I know there's some folks on here whose businesses opened up last week. And if you did, just kind of identify yourself through the chat, and Mandy could unmute you. I'd just like to hear from you guys if there's some things that you saw that surprised you or suggestions that you've got for some of our businesses who are on the call today that may be reopening. And there may or may not be, but if you can, just kind of chime in there. And one thing I'll say is the chamber has been at the table at all the leadership meetings we've had over the last 7 weeks, and it was never, ever anybody's desire to shut businesses down. That was one of the hardest things to do. Every single meeting we've had, we've talked about how to get to the point where we're able to open businesses up. From the mayor's perspectives, health department, West Tennessee Healthcare, everybody who's at the table on those conversations. So now we're at a point where businesses are being allowed to open, and now it's the desire to make sure we stay that way, because it would be very easy to go backwards. And so I think we ask all of you who are on this call, just make sure you keep pushing out information to folks that this is not a time to relax. It's even, I mean, you may look at it, and Kim, Tina, you can especially help here, maybe even be more diligent, because we are out amongst our community again. So we've got to follow these guidelines, because we could very easily fall back into a situation till we do have to have some new executive orders where we've got to shut down again. That's the last thing anyone wants.
Well, and one thing about the guidelines, I mean, they're not perfect. We don't have a playbook to go by on these guidances, but I promise you the folks in Nashville and our group here put a lot of effort into trying to come up with reasonable, safe guidances for y'all to operate your business. And I know it's going to be very burdensome on different kinds of businesses, but it's either guidance that hopefully protects you and your employees, but also protects your customer, that we're able to go forward. But if it was just open the door or not open the door, we couldn't be opening the doors right now.
Back to the wedding venues, let me just share something that I learned. I talked with an owner of a wedding venue who had a bride that was planning a wedding, and it's going to be a drive-up wedding. There's nobody that's going to be up at the altar but the pastor that's marrying the bride and groom, and people are going to pull up in their cars. The caterer is going to hand them a boxed meal to eat in their car while the ceremony is being put on YouTube or something that they can view in their car. And then they're going to drive around the venue and wave at the bride and groom. And I thought, well, how inventive is that? So there's ways to do anything, and you put your mind to it. And they're practicing social distancing. So I gave them my blessing because they had checked off all the boxes.
Necessity is the mother of invention, right?
That's right.
Someone did just comment that the state's numbers they read had jumped over 1,000. Any feedback or comment on that, Kim or others?
I haven't seen the state's numbers today yet. I know the state's ramped up a lot of testing. So anytime you have increased testing, you're going to see increased numbers. And obviously you're going to see some positives pop out of that. But I haven't seen them, so I can't really say.
Well, I think, if I'm not mistaken, Mayor Conger, isn't Nashville continuing on another week or 10 days with the stay-at-home order?
Yeah, I think Nashville is through the 9th, I believe.
Okay.
And so you look at, while we pay attention to state numbers, at the end of the day, we have to do what's best for Jackson and Madison County. And our numbers are looking very good at this moment in time. And so, while 1,000 in a population of 6 million is 0.01%, that's not even the case for Madison County. We're at a far lower threshold and ratio than that. And so we have to do what's best for Madison County and what's best for Jackson, and let those other local governments do what's best for their local governments.
And that's why it's important to meet as a group and continue to monitor the number of hospitalizations and the number of ICU patients, the number on a ventilator, so we can keep that curve flattened. And so as we meet daily and look at these numbers and our percentage of positives each day, we can continue to keep this group and work together to keep those numbers, keep that curve flattened, or take action if we see it starting to go up.
So all through this, we've seen different numbers and different data sets that we've got to pay attention to. And early on, we all, I think, were programmed to look at the number of cases as being the most important number. When really, so we're looking at this number in the state today, if that's increasing by 1,000, that can be totally dependent upon how many tests were given. But Tina and Kim, what do y'all look at, the real numbers that you look at to make your decisions on the recommendations that the mayors respond to?
Well, from the healthcare's perspective, we definitely look at the number of positives that we're getting each day. Right now, the health system just within our hospitals and our outpatient clinics. So this is only within this one healthcare system. Granted, there's a lot of providers across our area that are testing other patients. We've completed our percentage of positives is running right at 5%. But those are people that are presenting, that are sick, that have symptoms. We are not doing the type of testing where typically the drive-up testing where you can be tested without symptoms. So these patients that we're testing are symptomatic, and we have a 5% positive rate. So we do know that there's a lot of drive-through testing that's occurring across the region. For example, in Hardeman County, they completed testing yesterday, the drive-through testing to allow that access to that county. And so I think a lot of these increase in cases is because several of those outside Jackson health departments have been doing that testing. And so it's just a result of testing more people, we're going to get more positive cases. So, but that really the key for us is hospitalizations and the looking at the acuity of patients, how sick they are, whether they require ICU care or ventilator care.
And from our perspective at public health, what I'm looking at are the number of new positives that we get, but the source of that positive. If a lot of the positives I get, I'm expecting to get. Let's say if I have a husband that's a positive, Well, I can pretty much expect that that wife's going to be positive at some point. So I'm looking at the source. If I can't determine through contact tracing the source of that case, they have no idea where they got it, then it tells me that community spread is increasing. And even the, y'all have heard me say this before, the 17 cases that we looked at, that we tested through our drive-through that were of unknown origin, you know, we're continuing to follow those to see if we get any positive cases from them. We expect to see spouses, household contact come from that. But if we tie other people back to that, that's what we're looking at, the source of the infection. And we look at the number of positives that we have that require hospitalization, and we look at those same numbers that Tina looks at too.
It looks like one of our viewers still has a few more questions about the med spa and the services that they provide. Who would be the best person for them to call offline so they can get the details that they need?
I'll be glad to take that call and go over the guidance with them.
Okay. Because I think it may need altering of some of their services, that type of thing.
When we talk about going back to business, we all of us want to go back to the way it was before. For us, March 16th is when we started our declarations of emergency. We're in a new normal. We're not going to go back to the normal that we remember, and so we're going to have to alter what we're doing. Some additional alterations of what we're doing right now, and maybe those will go back to a normal down the road. But we all are learning as we're going along of how to live in this new normal.
Somebody's bragging. They said they went to Sam's Club today and 90% of the people were wearing masks. So people are listening. That's great.
Well, Mayor Conger, Mayor Harris, you got one more? You got any more questions, Mandy?
Nope, those were all the questions.
Appreciate both of you. Kim, Tina, appreciate you being on here. All of the rest of you. One thing I'll leave you with is that any questions that you've got, reach out to anybody in this group and we'll get those answers for you. You've got our email, cell phone numbers, whatever that is, because that is what has made this work, is this community continuing to communicate with each other. So we're going to keep doing that. And it's Friday afternoon. I told you we'd do this for 45 minutes. So that's about done. So all of you have a great weekend.
Bye, everybody. Good luck.
Bye.
Thank you.